Hello, everyone. Thank you so much for taking the time and being here today. This presentation is focused on linking trauma with the sensory system. We did have a part one that broke down the sensory system and different sensory profiles, so that may be helpful to watch before viewing this video. And this is a collaboration with me, Angela Tobin. I have a doctorate in occupational therapy and also am a licensed occupational therapist, as well as Sydney Pinder, who has her doctorate in occupational therapy. So we're coming from that lens, but with the content created specifically keeping kinship families in mind. And with that, we do want to thank OhioKAN for their partnership with Kinship Caregivers Connect for making this presentation possible. OhioKAN is a kinship and adoption navigator program, so I definitely recommend looking up their resources and their services as well. But we are so excited to have this series for kinship families. A couple of disclaimers. First, this presentation does discuss trauma and it does give some examples of traumatic events. So if this is triggering to you, you can skip over the trauma section in the beginning, but it is helpful for understanding the whole concept. The second disclaimer is this is not providing mental health or medical advice, and it is just general information. It could apply to everyone differently. So if you do have questions about the child in your care, we encourage you to consult a medical and or mental health professional. Before we get started with the presentation content, I do just want to invite everyone to be present. I know life can be so busy, so we can take a mindful breath together. And we'll start with an affirmation as we do at KCC. So this one says, I'm excited to explore new connections that I hadn't realized before. I'm excited to explore new connections that I hadn't realized before. And maybe today you'll learn something and make a connection with the child in your care or family member. And I think it's always helpful to just have more information and tools in your toolbox. So thank you for being here. And my hope today is that you'll also make a new connection, perhaps between the sensory system and trauma and how they can be interrelated. So here's our roadmap for today. We'll talk about the relationship between trauma and the sensory system. We'll give a very basic overview of trauma and the impact of the brain. We'll talk about attachment and sensory. We'll talk about trauma based sensory regulation strategies, other intervention options, and then self care, including for you as a caregiver, too. As I mentioned earlier, me and Sydney both come from a background in occupational therapy, so we are not experts in psychology or counselors. A lot of this information we have taken from Bessel van der Kolk and other readings and articles, and we will really be seeing it from a sensory perspective as well. So we're excited to kind of bring a new take on trauma and how it can fully impact a child, not just emotionally, but also their body and sensory system. And just for a little background of this perspective, so occupational therapy works with clients, which can be adults, kids, older adults, anyone, to really help them do the things that they need and want to do in everyday life. And this looks different from everyone. And that's what I love, especially about OT, is that we look at the whole picture. So we're not just looking at the person and their qualities, but also how is the environment supporting them or presenting barriers, and what is it that they want to do, what brings them worth and dignity. So in this presentation, we will be taking this whole person approach, and the person that can have to do with their, previous histories. It could be their sensory preferences. It can be the things that they find valuable. And it could even be like what their behaviors are, how they react in different situations. The occupation is just an activity that someone's doing. So this could include going to school, getting ready in the morning, bedtime. Sometimes we think just like occupation, job, but it's really those activities in daily life that we do, sometimes without even thinking about it. And then the environment. Sometimes this can be like getting up the steps to get into a home that might present a physical barrier to people, but also in terms like mental and emotional support. Sometimes if something is too loud or overstimulating for someone, how is that going to impact their ability to focus and to get tasks done? So it's really bringing everything together and considering how a person is doing. So we'll take this approach in discussing sensory and trauma today. So here's an example of looking at that whole picture or big picture. So we have a person interacting with their environment. So an example could be a kiddo getting to school, going to their locker, and then going to their desk. Let's say it's a kindergartner. So we would call like how they interact with the environment or how they do in that situation. We may call it their behavior or performance, how they're interacting with the environment. But there's a lot of things that we don't see behind the scenes that need to happen. Their attention, are they able to have that attention to remember, how to get to their locker, their thoughts and judgment and decision making, and being able to sequence all of the things that they need to do. And then also thinking about in the environment, is there environmental supports or barriers? An example of an environmental support is the teacher pointing to the locker and showing the kid, the way there, where a barrier might be kids standing in the way or talking too loudly, not being able to focus on the task or feeling overstimulated. So we often see this, how a person interacts with the environment, but rarely do we consider how the environment interacts with a person. And that's really what sensory input is. What is our body perceiving from around us and how are we interpreting it? That's the key part because the environment could be different, the same for everyone, but everyone can interpret it differently. So this can oftentimes be a missing piece because that can impact our arousal level and our processing and decisions. So it all influences each other, this circle. So paying attention to the environment, is it supporting, is it not, can be essential and really creating that safe environment for kids to help them regulate, which we'll talk about later on in this presentation. But that's why sensory, I feel like it's the hidden key at times, because it can be something that greatly impacts a child's behavior and just their ability to regulate in day-to-day life. So we will talk about a couple of different resource and book recommendations throughout this presentation, also where this information, a lot of it has come from. This, I feel like, is a must read for all caregivers and parents. It is brief and it's written specifically for caregivers, so I feel like it's very accessible in reading and digesting. And it's called The Whole Brain Child by Dr. Daniel Siegel and Dr. Tina Payne Bryson. So we'll use their concept of the downstairs brain and upstairs brain when talking about trauma and also sensory in the presentation today. So now we'll watch a YouTube video that breaks down the upstairs brain and the downstairs brain. So we'll be using these terms throughout the presentation. And then we'll go into talking about trauma and how that can tie in.
Your brain is powerful and strong. It helps you remember that 2 plus 2 equals 4, makes you blink and breathe without even thinking, and even helps you play your favorite video games. But it's so much more than that, too. Your brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. It also has 2 sides, a left and a right, 4 lobes, the frontal, parietal, temporal, and occipital. And then each of these lobes can be broken down even more into areas that have specific jobs. Yowza, that's a lot of pieces. Let's see if we can make it a bit easier to understand. You can think of your brain kind of like a 2-story house. In this house, there's an upstairs and a downstairs. The upstairs and downstairs brains both have very important jobs. Your downstairs brain's job is to keep you safe. It is responsible for things like breathing, super strong emotions like anger and fear, and watching out for danger. The upstairs brain's job is to help you think. Yep, that's right. Its job is to help you problem solve, learn, and make good decisions. A house wouldn't be a home without people inside, right? Your brain has some characters in it that play a really important role in what you're thinking, feeling, and doing. Let's talk about the characters in the downstairs brain first. Down here, you have alerting Annie. She lets us know if there's danger nearby. Angry Albert. He responds really quickly with, you guessed it, anger. And frightened Fred. He's pretty much scared of everything, but it's because he wants to keep us safe. Then there's the boss. This is Big Boss Bob. His job is to take information from Albert, Annie, and Fred and react. There is no thinking involved. He just listens to them, and if they say danger is nearby, he acts. super fast. Bob does this in 3 different ways: fight, flight, or freeze. Your upstairs brain has some characters in it too. Up here, you have problem solving Patty. She helps recognize problems and come up with solutions. Calming Carl, his job is to help us calm down when we're upset. Flexible Felix, he allows us to go with the flow. And focusing Frank, he allows us to pay attention and learn. All of these characters don't act super fast. It takes time for them to stop and think before doing anything. Any house with an upstairs and downstairs has a staircase that connects them, right? So does your brain house. We need both the upstairs and downstairs brains to work together. When the brain's staircase is built and strong, our characters can move up and down the staircase to share information. This allows the upstairs brain to try and make sense of strong emotions from Albert, Annie, and Fred, and try to figure out how to help. But it's not always that easy. You see, even though your downstairs brain is done being built when you're born, your upstairs brain is under construction until you are in your mid-20s, which means your staircase can be kind of fragile as a kid. And Bob is kind of bossy. So when he thinks that danger is around, he may flip a switch to break your staircase in order to keep you safe, even when there's no actual danger around. Let's look at it this way. Let's pretend that you are out at recess. The sun is shining, it's nice and warm out, and you're playing with your friends. All of a sudden, a cute little kitten wanders on the playground. Annie, Fred, and Albert are going to say, "Aw, look at that cute kitten." Bob will send a message upstairs to say, "Everyone, look, it's a cute little kitten." Bob doesn't sense any danger, so problem-solving Patty is able to stop and think about what to do next. Patty decides that you should probably go and tell the teacher that the kitten is on the playground. Maybe it's lost and your teacher can help get it home. Awesome. The upstairs and downstairs brain worked together to solve the problem. Now, let's take the same day at recess, but add something different. Instead of a kitten that shows up, a giant T-Rex stomps onto the scene. Annie immediately goes over to Bob and says, Bob, we have a problem." Fred does the same thing, saying, "There's a dinosaur on the playground." Bob has no time to go upstairs so Patty can figure out what to do. Instead, he flips the switch to break the staircase and responds super fast by having you run away, flight, and hide, freeze inside of the school. So clearly, Bob is really good at acting fast to keep us safe. Unfortunately, your brain, and Bob in particular, cannot tell the difference between a hard question on a math test and a dinosaur on the playground, especially when Bob flips his switch to break the staircase. But guess what? You can make your staircase stronger by practicing calming strategies like deep breathing and learning how to relax your muscles. The more you practice these when you feel good, the more likely Bob is to respond to them when your feelings get too big. Trusted adults can also act as carpenters for your broken staircase, rebuilding each step to help Bob reach Patty and solve the problem together. Teachers and parents, for more information about the upstairs and downstairs brain, visit selsketches.com.
Thank you all for watching this, and we will again use these concepts when linking this with sensory and trauma. This is a definition of trauma from SAMHSA, and I'll read the full definition and then explain a little bit afterwards. So, results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful and threatening, and that can have lasting adverse effect on the individual's functioning and physical, social, and emotional well-being. So we have 3 parts to this definition: the event itself, whether it occurs once or multiple times, which we'll talk about next. What I have highlighted here is that is experienced by an individual, because trauma, it's not the event itself necessarily, it's how a person is perceiving it, if they feel unsafe or at risk of harm, or that is harmful to them, either physically or emotionally. So sometimes when we hear about like car accidents as a physical trauma or going to war. Obviously, there's physical and emotional traumas there, but it's not just a physical harm, emotional harm can also be a huge part of trauma. And also having a lasting adverse effect on the individual's well being. And it can affect their well being in a lot of different ways, which we'll also continue to talk about in this presentation. Similar to what we were saying with the sensory system, how everyone can perceive the same environment differently, trauma is in the eye of the beholder. So it's all up to the person in that situation. So what might be a traumatic situation to one person might not be traumatic to another. And there's so many different personal, individual differences that can go into this. But it's really important to know that when a person says a situation is traumatic to them, they are the only ones that can say it because they are the ones experiencing it. Here in this definition, it does say physically or emotionally harmful too. So, just to say that there can be emotional harm that can be very traumatic without necessarily any physical harm or injuries. So, it's important to think about trauma in different ways and to expand how we think about trauma. Really, it is depending on how that individual is experiencing a situation. There are three different types of trauma generally. There's acute trauma, and this is trauma that occurs one time. So, again, using the car accident example, that is an example of an acute trauma. There's a beginning and end to it after that one time. Chronic trauma is trauma that occurs in an ongoing manner. It's like the same thing that is repeated. So, an example of this could be if you're in the military and at war, you see a lot of similar travesties happening while you're, in that position. And another example could be a medical trauma. If someone has a condition that causes a lot of physical pain or emotionally pain ongoing, that's traumatic to them. And then this last type is complex trauma. What makes complex trauma different is that it is a betrayal or a brokenness in trust that goes along with the trauma. So, this is a trauma that often occurs with a trusted individual or someone that the person knows taking advantage of them or causing harm. So, an example of this could be physical abuse or sexual abuse by someone known and trusted in the child's life. And specifically, complex trauma often relates to when people are children or at a younger age or adolescence as well. Part of understanding trauma is understanding how our body reacts to stressful situations. So here's a picture of a tiger growling at you. I don't know what your first thought is. My first thought is to run away, get in a fetal position, close my eyes, hope that it goes away. I guess I would have a freeze response. But our stress responses started biologically because of a need to keep ourselves safe. They talk about the cavemen, the hunting lifestyle. So our response to stress was initially that like acute stress in these situations. How can we remain safe? However, it's adapted over time, and our experiences of trauma can impact how we react to stress and how long that stress can affect us as well. Briefly, we'll talk about some different stress responses. I feel like this could be a whole presentation of itself. So, if it's something you're interested in, there is tons of resources on this. But how are these different ways that our bodies can react to stress will also tie into sensory responses too. So, I may use some of these words. So, one example is if can I escape whatever is the stressful stimulus? Yes, then the response may be to flee or run away. If not, can I overpower it? And that would be the fight response. If we attack the threat before it attacks us, we might be able to weaken it and keep it from attacking in the future. If not, can I make it lose interest? And this would be the freeze response. If our body closes up, becomes rigid, and won't move, we may be able to make the threat notice from becoming interested in us. And then if not, then completely collapsing, that state of helplessness in our mind and brain may disconnect, sometimes called dissociation. So this is an example using that lion of the different stress responses, but in day-to-day life, there's not a lion there. There can be something else that represents that stressful event. This is tying different types of stress that we may experience. So there can be different types of stress as well. There is something called positive stress or eustress, and this can be normal and essential part of healthy development in daily life. So an example of this type of stress could be planning a wedding, getting a vaccine. You know you have to do it, but you might be stressed about it. There is, so not all stress is necessarily bad to say, and we all do experience stress in our everyday lives, but what can go from stress to, trauma is the intensity of it and also how long it can occur. So we have tolerable stress now, which is response to a more severe stressor, but it is limited in duration. So kind of going back to that acute trauma. So an example of this is loss of a loved one. And it's tolerable because we have that increase in stress and then we drop back down as we are regulating and healing, and we see it's not forever. So that is why it's called tolerable. The last type is called toxic stress, and this especially can occur with complex trauma or chronic trauma that is ongoing. But this is experiencing a strong, frequent, and or prolonged stress reaction. And I think it's important to notice that our bodies aren't meant to be in a stressful state forever. It's meant to be that response to keep us safe, and then we turn back to the regulated state. But with toxic stress, we're staying in that stressed situation or that stressful mindset, even if it's not the situation, for a long period of time. So, an example of toxic stress could be ongoing physical or emotional abuse. It could also be ongoing job stress or ongoing, postpartum stress. So, there's different situations. But just to say, stress in and of itself is not necessarily bad, but our bodies are not meant to tolerate stress long term, and that's when it can become toxic. We talked about trauma responses from an evolutionary standpoint with the example of a tiger. These are trauma responses that are widely accepted today with some different examples, and there may be more than this four. These are the four most commonly identified. So we have fight, flight, freeze, and fawn, and you may or may not have heard of the last one. But fight could look like anger, irritability, aggression, and these can be kiddos that frequently either like lash out, can be the term used, or yell, or when they feel threatened, really have that heightened energy and response, which would be their fight response. Then there's flight, which is escaping a situation. So this can include like avoiding different triggers or avoiding panic. It could also look like fear and anxiety towards situations. And perfectionism is also an example of flight because you're avoiding making a mistake. And that could be being nervous about what consequences might mean for that. So you're avoiding having conflict. There's also the freeze response, and this can look like zoning out or feeling stuck. It can also be described as dissociation or detachment and depression. So, freeze means like feeling immobilized, whether that's mentally, physically, and not necessarily having motivation to do things in everyday life or feeling like you're able to. And then finally, fawn is people pleasing. So this is accommodating other people to avoid making them upset or to avoid conflict because you could be afraid of the consequences for that. So this can include like difficulty saying no to other people or difficulty setting boundaries because you're scared of what that could lead to. So, this is a reflection question for you, and the answer could be different for everyone. But think about a stressful situation for yourself. And it could be something that happened recently, or it could just be a hypothetical situation. What is your body's first reaction? How does your body react to stress? And again, think about your body, your physical reactions. My reaction to stress is clenching up and like getting really tight. I can feel my heart rate increasing. Sometimes I can start to breathe really heavy. Sometimes I might start sweating, and I can clench my jaw and just have, my mind not able to focus on anything, feeling overwhelmed. So again, this is just showing that stress, it's not just a mental or emotional impact, it's an impact on our physical body too. And with long term stress, we do see long term impacts on physical health. And there's also, they talk about like the brain gut connection. So people who might have prolonged stress could have stomach issues or, autoimmune responses. So there's definitely that connection to your physical well being with stress. So now we'll talk about some brain anatomy and findings from The Body Keeps the Score by Bessel van der Kolk. So we'll really tie in those concepts of the upstairs brain and downstairs brain to different structures within the brain to better understand how the brain processes trauma and then how can that impact the physical experiences as well. So we have the brainstem, the limbic area, and the cortex and prefrontal cortex. The brainstem, or the downstairs brain, is the lower part of the brain that's the first to develop. So it's really our primal instinct, our primal reactions, and it's what keeps us physically alive. So it includes automated responses such as breathing, sleep, and temperature regulation, which we just mentioned. Those can change during stressful situations. We have the limbic area, which is part of the staircase from that video, or it's the Bob who decides, like, does this information need to go to the upstairs brain for further processing, or is a fast reaction needed where it will stay in the downstairs brain. And then we have the cortex and prefrontal cortex, which is the most advanced part of the brain, or upstairs brain, and this develops last, and it has factors such as decision making and sense of self. So lots of different things happen in the upstairs brain, but they may need to pass through the downstairs brain and limbic area first to get there. This is a diagram I put together based on The Body Keeps the Score of how the brain can process information from the environment. So we have all the sensory input coming in at once. So we have our sight, smell, hearing, taste. We'll also talk about like the vestibular and other responses. So our brain has to mix all of these sensory and stimuli together very quickly to think how much our body is processing at once. But this all gets integrated or mixed together in the thalamus, which is also called the cook. So the thalamus passes on this information to the amygdala. And the amygdala, which was called Bob in the previous video, or van der Kolk calls it the smoke detector, because its job is to determine if the incoming stimuli or if the environment is a threat or harmful or not. So its job is to keep you safe. If it's determined that the information coming in or the environment is threatening or harmful and that you need to react to this with those stress responses, fight, flight, freeze, or fawn, the smoke detector will go off and it will release stress hormones that go into your body and, go into the stress response. So that's the downstairs brain where it stays downstairs. However, if information comes in through the thalamus and the amygdala determines this is not a threat, we are safe, then it can pass on the information to the hippocampus, and this integrates short term memory going towards long term memory and to the cingulate cortex. And sometimes, why experiences of trauma people may not remember them or dissociate from them, it may not pass through the hippocampus in the same way that non traumatic experiences do, just as a side note. But then after it passes through the midbrain, it will go to the prefrontal cortex, which is the upstairs brain, for decision making, to take time to process it and see what the next step is. So it is a little bit wild to think about just how much our brain does without us even realizing it to make a decision. The prefrontal cortex is also called the watchtower by van der Kolk because its job is to also look out and try to avoid stressful events in the future or try to prevent these triggers or events from happening. So this is a little overview of how different information can flow through the brain and how a stress response stays in the downstairs brain, where it's something that isn't stressful can pass through to the prefrontal cortex, and we learn how to adapt continuously. This is a simplified version, just to say, but just a different way of seeing it and thinking about it. For those experience toxic stress or long-term stress, they really may be acting out of that amygdala very frequently, where the smoke alarm keeps going off. And then it just becomes more of an automatic response. So even if objectively a situation is not threatening to them, it continues to feel threatening, and they have that response of dissociating, of fighting. Again, those different trauma responses. So when these trauma responses occur, it's not the top of the brain deciding to do this. It's not a chosen behavior. It is an automatic survival response. So I think that's really important to keep in mind that a lot of times, especially for people who experience complex trauma or ongoing stress, their amygdala can even be triggered even more easily in the future, and it can be a continued stress response in that smoke detector part of the brain. Some different functions of the upstairs brain include multisensory integration, social interaction, sense of agency, which means your sense of self, your sense of being able to accomplish things in the world, and emotional regulation. So these are all upstairs brain functions. And I'll really focus on, we'll talk about self regulation and emotional regulation later on, but that multisensory integration, that doesn't happen until the upstairs brain. And what multisensory integration means, it's your body's ability to filter through the sensory information, pay attention to what's important. So this doesn't necessarily happen naturally. It's a function of our brain, and it is an adaptive response because at times we need to know what to focus on. And in different situations, we may be focusing on different types of senses. So an example is when you're driving, that visual and auditory sense is really important. Sometimes you may have to turn down the radio when you really need to focus and pay attention to directions. And then if we're in a loud coffee shop and working, sometimes our brain can filter out the background noise of the coffee shop. So it's our ability to filter out certain senses or also increase the volume of certain senses. So, a possible explanation of why kiddos who have experienced trauma or adolescents may have more difficulty with sensory regulation is because they're functioning more out of their downstairs brain and reactive to the environment instead of having the ability to use that skill and muscle of determining what, senses or what to pay attention to in the environment. These are some quotes from The Body Keeps a Score that can link, again, sensory and trauma. So Vander Kolk says trauma victims cannot recover until they become familiar with and befriend the sensations of the body. Being frightened means you live in a body that's always on guard. An example of having a body on guard might be being more sensitive to the environment in order to sense threats more quickly. So being more sensitive to sound, being more sensitive to touch, to avoid traumatic experiences from happening again. Another response to trauma in the body that could happen long term is your body, again, has that alarm going off constantly with chronic or complex trauma or long term stress. And then at some point, your body may just decide, like, this is too much. We can't be on alert all the time. And another reaction could be dissociation as well, which is actually pulling away from processing the environment. Again, that freeze response. But then Vanderkolk goes on to say, in order to change, people need to become aware of their sensations and the way their bodies interact with the world around them. Physical self awareness is the first step in releasing the tyranny of the past. So I definitely recommend this book too. He talks about physical and somatic interventions that support healing from trauma. And in this presentation specifically, we'll be talking in the context of sensory and some sensory supports as well, and also how attachment and sensory are linked. This is a relatively new area of research because the sensory system is pretty niche, but there is preliminary research saying that children who have experienced trauma are more likely to experience difficulties in sensory processing for all of the reasons we just explained. And then there is some evidence for sensory based interventions for children who have experienced trauma. But like I said, this is kind of an upcoming area of research. There is also research that has linked trauma to other symptoms from other disorders, such as ADHD, saying PTSD and ADHD may have overlapping symptoms. So we're not focusing necessarily on the diagnosis here, but just some explanations of how trauma can impact the sensory system specifically. Sydney will now review the sensory system, but we do recommend, if you have not watched part one, to go check that out because we will be talking about some of the different sensory profiles going forward in this presentation. We'll start off with a review. So, the sensory system is the part of our body that processes sensory information we're receiving. We have our five basic senses. So, visual is seeing, auditory is hearing, olfactory is smelling, gustatory is taste, and tactile is touch. And then we also have three hidden senses. So, proprioception, that's our body awareness and how we feel our body and limbs in space and perceiving pressure. And then vestibular is movement and balance, and interoception is those body signals that we're getting internally. So when we're hungry, when we're thirsty, when we're sleepy, and so on. And everybody has sensory processing, which is how we organize information from our body and from the environment, which then allows us to interact with and adapt to our surroundings. And sensory processing depends on two things: how we are receiving a stimulus and how we regulate or respond to that stimulus. And for some context, a stimulus is something in our environment that our body responds to. Sensory modulation is a part of sensory integration that can turn the volume up or down within our sensory system or up and down within certain senses. Again, this is in the prefrontal cortex or the upstairs brain. So, this is a higher skill of our brain that is adaptive or learned over time. And sensory modulation can affect our arousal level and sensitivity to sensory input. So if you're tired, you may have the volume turned down. You might be less sensitive to sensory input. That's why driving tired can be dangerous. Or if you're in a higher arousal or stress situation, then the volume may be turned up and you may be hyper aware of what's around you to the point where maybe you can't focus on a task in front of you. Our body can react to different types of sensory input in different ways. And some of this may be like a learned response from if there's a previous trauma, certain senses may remember that trauma more, store it in the body more. So we may be more reactive to different types of sensory input. Um, so sensory modulation is key for understanding why sometimes the sensory system can react differently, especially for those who have experienced trauma over time. Differing sensory profiles that can go with differing patterns of modulation. And these are mentioned again in that first part one presentation as well. We have sensory overresponsivity or hyperreactivity. So, this is where the sensory system is very sensitive to the environment around them. The environment is, or the volume is turned up, and this can be a response for kids who are on alert. Again, that can be a traumatic response for their bodies over time. So that means things might sound louder, or they may feel overwhelmed with different environments easier. There's also sensory underresponsivity, and this can be linked to dissociative responses. So this means that the volume in the world is turned down, or it's harder to notice things in the environment. It could also look like zoning out or having difficulties paying attention. And then there's also a sensory seeking profile, which is wanting more from the environment. So there are sensory profiles, again, in the last presentation that aren't necessarily tied to trauma. Like, we all have different sensory profiles, not always in the context of having experienced trauma or not. Some of that can be genetics, just how our body is. So there are a lot of natural differences, but this is more bringing it into the context of how trauma can impact like the body's sensitivity to sensory information. This is just putting a visual to what we just talked about and how people can react, or their body can respond to the same environment differently depending on their sensory modulation, how the volume is turned up or down. So, for those that have an optimal arousal throughout the day, there may be sensory events that occur, but we're able to stay regulated throughout or come back down after, higher intensity events. So, for example, say your alarm wakes you up, you're getting ready, you get on the bus, and the bus is really loud. Even if it's a little bit uncomfortable to you while you're on the bus, you're able to, after you get out of that situation, come back and be regulated, and then just adapt your energy to different times during the day. So, during recess, your energy might go up and then able to come back down again. And having that ability to focus on tasks when needed, but also when you're put in different such sensory situations, just tolerating it and being able to regulate afterwards. However, for those that may experience high arousal or over responsiveness to the environment, they may experience something called sensory overload. And this can be described as like a traffic jam, like all the information from the environment's coming in, but your brain doesn't know how to deal with it. You may feel like you want to shut down. It's like too much to process. And for kids who are on high arousal, their arousal level, even from the beginning of the day, may be all the way up here. And things throughout the day can start to feel more and more overwhelming. And it also may make your body and brain more tired throughout the day. Another example of sensory overload is just not being able to recover from a high intensity or higher intensity sensory event. So if we go back to the example of the bus being loud, your body just has a big reaction to that and is not able to self-regulate afterwards, and then is experiencing sensory overload throughout the day. And this can really affect our ability to pay attention and take in new information because our brain isn't really able to prioritize what information to take in. It's just feeling overwhelmed by the environment. There's also low arousal, which means we're not processing the environment as much, or the volume is turned down, or also called under responsiveness. And this means a kid or adolescent may have a hard time with getting their energy up and interacting with tasks throughout the day. So even though it's the same day, like waking up, going on the bus, going to class, whatever the schedule is, everyone's sensory system can respond to it differently. So, for some sensory supports, there are two different approaches for having interventions for sensory. And one is sensory adaptation, the other is remediation or building skills in sensory. So, we'll talk about what those two different interventions look like. This is very high level, so it's definitely encouraged to consult an occupational therapist or someone else on your kiddo's team to implement these. But this is just to show what some options are. And in OT, we're always about building skills, really helping that person have those skills, but then also, when necessary, adapting the environment to better support a child or adolescent. Sensory integration, again, that's remediation. So that is working on the muscle of sensory modulation in the upstairs brain, as we mentioned. It was developed by Jean Ayres within occupational therapy, and it teaches children with sensory difficulties skills in regulating and coping with different sensory input through self-directed play activities. And an example is building coping skills. So when you're on that loud bus, you're able to self regulate and come back down and go about the day instead of being in sensory overload the rest of the day. Another example of sensory integration therapy is for picky eaters, introducing them to foods with different tastes and textures to try to be able to tolerate more different things. So it can be used in different contexts, but it's again building that sensory modulation skill. And it has to do with both the sensory experience, but also the child's ability to adapt to the environment. Sensory adaptation, which is highly effective, and it's not only used by occupational therapists, it's used by caregivers, it's used by schools, and this can be very helpful in building a more supportive environment for kiddos. So it involves changing the environment to support a child's optimal arousal level. So Sydney mentioned these in the previous presentation. Examples include a sensory diet, which the word diet can be a little confusing, but it just means more of a routine, and it's different for each child or adolescent, and it's established individualized routine that is implemented to support the child throughout the day. So these can be done in school or at home. And an example is having walking breaks throughout the day in order to help attention during school tasks. Another example could be using headphones at certain noisy times during the day if needed. And then we also, an example is a sensory room or a calming corner, which we gave different examples for in part one. So sensory supports must be individualized to each child. Everyone has a different recipe for optimized regulation. So some, even for different senses, it's different for different people. So it's really important to get to know your child and also consult a professional too. And sensory supports can help a child regulate in order to use the staircase going forward. So again, it's really focused on changing the environment so that stress response might not be triggered as easily and kiddos are able to use the staircase in making decisions. Sensory adaptations, it's called bottom up because you're trying to adjust the information coming into the brain. And Sydney will go on to talk about attachment and sensory. I know we threw a lot of information at you. Hopefully, this is helpful, though, just for understanding sensory a little bit differently and how it can not only relate to different like disabilities or physical conditions, but also mental health considerations as well, including trauma and attachment.
So now we'll get into a little bit about the caregiver-child attachment and the sensory system. Now, I want to highlight some different attachment styles that a child may develop. And so, attachment theory, it's a social and emotional developmental model that predicts that responses by a caregiver to a child end up leading to their development of attachment patterns. And then this attachment affects how they show up in different relationships in life. But the four that we have here are secure attachment, insecure avoidant, insecure ambivalent, and insecure disorganized. So, with that secure attachment, the child trusts that their needs are going to be met by their caregiver, and they are confident in that. And so, then they are easily soothed in times of overstimulation or dysregulation. And then for the three insecure attachment types, the child's needs have not been consistently met by their caregivers in the past, leading them to have more difficulty with regulating themselves. So, insecure avoidant attachment, that could look like the child appears aloof and emotionally distant because their needs have not been met in the past. With insecure ambivalent, the child may appear easily upset and difficult to soothe. And then insecure disorganized is when it has been inconsistent with whether the child's needs have been met or not. And so they may lack an organized pattern of behavior because at times their caregiver met their needs and at times they didn't. And so it's been a source of comfort and fear. So, the relationship between sensory processing and caregiver child attachment is bidirectional. They impact each other. So, if a child happens to have difficulty with sensory processing, if this is just something that they are predisposed to at birth, then this can end up leading to challenges with forming a secure attachment with the caregiver. And then on the flip side, the child caregiver attachment can either support or challenge the child's development of their sensory processing. And this is just showing the differences between attachment styles and how that leads to different levels of sensory processing. So, if a caregiver responds to a child in a consistent and sensitive way, leading to a secure attachment, then there's a development of self regulation and sensory processing skills. And that self regulation piece is being able to recognize how you are feeling emotionally, your thoughts, your behaviors, how you feel physically, and then be able to respond and regulate that in a healthy way. And then, if an insecure attachment is formed in young childhood, then there's most likely limited exploration with the child's environment, and that leads to limited sensory experiences. And so, then there are challenges with sensory processing in this case. I mentioned self regulation in that last slide there, and so I want to go over that a bit more. Regulation is the experience of having balanced and steady state of emotions, thoughts, behaviors, and body functioning. And we develop regulation in three phases. Everybody does, and everybody starts off in infancy with requiring external regulation. They're only able to be soothed and regulated with the intervention of another person. And then the next phase would be co regulation, where somebody is able to regulate with the support and assistance of another person. And then from there, we get into self regulation, the ability to regulate on one's own because of the previous co regulating experiences they may have had. At this stage and point with the child in your care, you may be at a spot where you are still needing to help them with co regulation. And it may be difficult at times due to decreased external regulation from infancy, but there are still some strategies that can be used for this. And we'll get into some of these strategies now with some trauma based and sensory regulation. The first strategy I have here is trauma based, and it's regulate, relate, reason. And it focuses on calming the body before calming the mind and emotions if somebody is dysregulated. So, the first step is that co regulation piece, supporting the child to regulate physically and emotionally with sensory strategies. And then you can establish a relational connection once that child is regulated. And from there, you're able to converse and reason with the child to talk through the emotions and potentially even discuss what they can do next time this happens.
This relates to the upstairs brain and downstairs brain framework we were discussing earlier, because by starting with regulation, we're helping a child to feel safe in their environment first, so then they can engage the higher parts of their brain. So, again, that felt safety physically and emotionally is really important to establish before moving up the chain into reasoning, because that is a higher level brain functioning. And sometimes it can take a while to regulate, and leaving that space and time for regulation can be truly key in implementing this.
I really want to emphasize this co regulation piece. So, again, co regulation, it's the ability to regulate oneself when managing a stressful situation or sensory input that can be uncomfortable for somebody. And it's with the support and assistance of a connected person. And having co regulation nurtures connections between caregivers and children, and it helps the child to develop their emotional intelligence, social emotional learning, and their own self regulation skills. And now I have a couple of tips for co regulation. So you can always model self regulation and model how to safely and healthfully manage stress and other emotions. So you could do this by showing how you take deep breaths, or how you count to 10 before responding to a situation, or even just how you are checking in with your body, taking a moment to see, how is my head feeling? How is my stomach feeling? And so on. And then you can also repeat these regulation strategies with the child in your care, because engaging in them more often help children to stay regulated throughout the day. And you could even make it a part of your daily routine. And the more that the child gets to practice this with you can help to lead to their own self regulation. Another tip I have is guiding the child through recognizing signs of dysregulation. So you can ask them how different parts of their body are feeling and help them to understand why. So you can explain that when you feel your heart racing, that may mean that you are nervous or excited. Or when you feel your cheeks get a little warm and your fists are clenching, that may mean that you're angry. So helping them to recognize these signs, these bodily signs, help leads into the next step of how are we going to regulate ourselves. And so this is where you can help with guiding through regulation strategies. You could cue them at times by inviting them to go into a calming hideout space or other exercises. You can guide them through breathing, mindfulness, or some of the other strategies that we'll go through next. And then, as you are going through this co regulation with them, it's important to maintain calm body posture and calm facial expression, since children can really read off your energy.
It is important to note that some of these strategies are especially helpful when you are able to catch those stress signs early and notice that a child may be becoming more anxious or agitated. So, putting them in place then. However, there are instances where a child may have a dramatic stress response and it may seem like flip of a switch. And once they're in that stress reaction, they may not be able to listen or follow instruction. They may be having a meltdown or feel very overwhelmed. So it's important just to give the space and show support how you can to them until they're able to calm back down. And then using some of these skills in reflecting back of things that they noticed leading up to this or what might have been the trigger. But just to say, if a child's having a complete meltdown, you sometimes will not be able to talk with them because they're, again, processing out of that downstairs brain. So just creating a safe space for them is sometimes the best thing that you can do.
And before we continue on to some more strategies, I want to give a moment for some reflection just to think about what a co regulation tip is that you plan to start using with the child in your care in the future. And now I'll share some more suggestions for sensory regulation. So, calming cards are an option, and these calming cards have sensory options. So, these help a child to decide which sensory strategy they want to use to regulate or prevent dysregulation. It gives them some autonomy and choice in choosing how they are going to respond. So, some examples here are taking a walk, stretching, doing 10 push ups, or squeezing a stress ball. And here we have a grounding strategy called the 5-4-3-2-1 strategy. So, this is where you can use five of your senses: sight, touch, hearing, smell, and taste to bring one back to the present moment if they are overwhelmed, stressed, or dysregulated. So, it's five things you can see, four you can touch, three you can hear, two you can smell, and one that you can taste. And when I've done this before, I know I've struggled at times with thinking about four things that I can touch if I'm just in one spot. And so you could even just think about how your feet are planted on the ground, or if you're outside, how you can feel the wind on your face. And then another one that can be difficult or give me pause at times is, what is one thing you can taste? And for that, you can always use the aftertaste of the toothpaste from the morning or the aftertaste of your breakfast, and so on. Breathing exercises can also be helpful, and controlled breathing helps with that regulation by sending a message to the brain that the body can relax. And with children, it can also be helpful to use visuals to control that breathing. And so, here to the right, I have an example of figure eight or lazy eight breathing, where one is tracing around the eight to breathe in and breathe out. And to start off with these breathing exercises, it's a good idea to go through them with the child so that you can help them with pacing their breath and so that they're not going through it too quickly. And I want to touch on trauma informed mindfulness because not all of these regulation strategies work for those who have experienced trauma. So we have this graphic here provided by Beth Tyson, who came and spoke to the group about ambiguous loss and different ways for children to cope with that. And so this graphic just informs us that if one has experienced trauma, it's okay for them to stop engaging in a mindfulness practice if they recognize that it's not working for them. Also, keeping their eyes open is important, as that may help with just being aware of your surroundings and staying in the present moment. And then it's also helpful to not focus on the breath for trauma informed mindfulness. And then the most optimal strategy is moving your body. And that brings us to yoga or guided movement. So, this just utilizes movement and balance to promote physical relaxation, and it can reduce stress and anxiety. To the right here, I have some kid friendly yoga poses. It can help sometimes to make the yoga poses sound a little bit more fun with younger kids in your care, but using this is an optimal strategy for trauma based mindfulness. And I want to provide another moment for reflection. So, have you used any of the strategies mentioned with the child in your care? And you can think about how it went if you did use them. And you can also think about if there are any other strategies that I didn't mention that have worked for the child in your care. Now, I want to get into some self care for you all because sensory adaptations and strategies are for anybody, really, because everybody has their own sensory preferences. And it can be really powerful with calming as well. There are several benefits of sensory adaptations for adults specifically. So, it can help with calming and focusing, promote feelings of connection to one's body, improve stress management, increase self awareness and self regulation. And on top of that, they are easy to use in the home and can also be used anywhere at any time if it's a strategy that you are able to use out in the community. So, I have some suggestions here for your all self care that involve some sensory. So, it could be pet therapy, playing your favorite music, using pressure to calm, like a weighted blanket or a self hug, having different sensory items on hand, like essential oils for some aromatherapy, different fidgets if you want to do something with your hands or painting. You can also create your own sensory calming space where it's just a little bit more isolated and quiet, and it's just a place for you to take a moment for yourself. And then you can also create your own sensory routine for each day if you know that there are certain activities that help you to wake up in the morning or help you to calm down in the evening before going to bed. And here's a moment of reflection for you all. So, what signals does your body give you when you're feeling stressed or overwhelmed? And then, what type of sensory based strategies would you use for yourself, use to respond to those signals? Thank you all for listening, and I hope that the information and strategies that I provided are helpful. Thank you again.